Hello all of you, welcome back to our channel which is Study Smart with me. And how's you all? I hope you all are good and doing study all together. Also my videos are helping you a bit in your preparation, I think so, and I'll try to upload more and more videos. I'm trying it to getting more content for you, so it will be helpful for your FMG, either the NEET PG, INICET, AIMS, or in your MBBS study too. So let's start with our video from the question 36. So all of the subsequent pairs relating to adult derivatives of embryonic structures are accurate with the exception of which one? Do focus on the exception word. So what would be the answer, guys? Umbilical vein ligamentum teres, ductus venosus ligamentum venosum, foramen ovale fossa ovalis, and umbilical arteries lateral umbilical ligament. Let me know the answer. What would be the answer? Yeah, answer is D. Umbilical artery is lateral umbilical ligament. Why it's not correct? Why it's not correct? Tell me. Because this is medial one. Let's go with our explanation work. Umbilical arteries become medial umbilical ligaments. Lateral umbilical ligaments are raised by the inferior gastric artery. Okay, lateral is with inferior epigastric artery. The median umbilical fold extends from the apex of the bladder to the umbilicus and contains the urachus. The medial umbilical fold covers the obliterated umbilical artery. The lateral umbilical fold contains the deep inferior epigastric vessels below their entry into the rectus sheath of the superior vesical arteries. Okay, let's come to the another question. A patient presenting with wasting in the interdigital web spaces, experiencing numbness in the ring finger, and demonstrating Wartenberg's sign during physical examination is most likely suffering with. Tell me the answer. What would be the answer? What would be the answer, guys? Yeah, answer is cubital tunnel syndrome. So what is the answer? Explanation: cubital tunnel syndrome, because cubital tunnel syndrome is a condition caused by compression or irritation of the ulnar nerve, right? Over here, what is the what nerve get compressed? Compression of ulnar nerve, correct, as it passes to the cubital tunnel at the elbow. This tunnel is formed by bone, muscle and ligaments, and when the nerve is compressed, it can cause the numbness here, tingling and pain in the ring and little fingers, right, as well as the weakness in the hand. The condition is often exacerbated by prolonged elbow flexion, such as during sleep or when using a phone. So don't use phone too much and don't sleep on your hand or just flex your elbow. Some of the people having a habit that they put their hand below their head and they sleep. So by that also our nerve can compress. And which nerve it is? Yeah, ulnar nerve. So do focus on the points. Don't sleep in that way and don't use a phone too much. Okay. Risk factors include repetitive elbow bending, direct pressure on the elbow, and prior elbow injuries. Symptoms typically develop gradually and may worsen over time. So this is the cubital tunnel syndrome. This ulnar nerve. This. Diagnosis involves physical examination. How you can diagnose it? Physical examination, nerve conduction studies. You can do nerve conduction studies and sometimes imaging. Okay, and treatment would be conservative. like activity modification, splinting, physical therapy to surgical intervention in severe cases. Surgery may involve decompressing the nerve or transposing it to a new position. Okay. Now let's come to the another question. What is the another question? This one, guys. A 54-year-old male with diabetes present with symptoms of fever. Fever है, headache and fever, headache and pain है in right eyelid. So upon examination, vesicular lesions are observed on the upper eyelid, forehead and nose on the right side of the face, indicative of herpes zoster. Which nerve is most likely affected? Tell me the answer. Tell me the answer. What is the answer? Yeah. I hope you all get it. Ophthalmic nerve. Great. The ophthalmic nerve, there is a lot of things given. First of all, upper eyelid, fever, headache, pain. Now, herpes zoster is the indicative where the pain is upper eyelid, vesicular lesions are there on nose, right side of the face. So you get the answer very easily. Ophthalmic nerve is a terminal branch of the trigeminal nerve along with the maxillary and mandibular nerve. The ophthalmic nerve provides sensory innervation to the cornea, ciliary body and iris, to the lacrimal gland and conjunctiva, to the part of the mucous membrane of the nasal cavity, and to the skin of the eyelids, eyebrow, forehead and nose. The presentation is consistent with the herpes spread along the course of the nerve. See this diagram, you can go through with all sort of nerves. This is the ophthalmic nerve, this is the maxillary nerve, mandibular, trigeminal, cavernous, superior orbital fossa, fissure, lacrimal nerve, nasociliary nerve, frontal nerve, and don't forget your ophthalmic nerve. Let's come to another question. It is clinical, also a image based question. You will get to know by the image also. Sometimes you get the answer by image itself, but don't forget to read the question. Sometimes it asking the exception over there or not correct, right? And you will be writing the answer of the correction. So when you are giving exam, do focus on the question itself, and if you are not getting your question, you are not understanding your question, read it in a retrospective manner. Just read the down one last line first and then go through with the question when question is in a very length. Okay, so this is just a tip for your exam, and don't get a fear of solving any question. If a question is big, answer will be easy only. Okay. A 25-year-old male exhibits the described deformity as a result of overhead weight lifting exercise. Which muscle is implicated in this condition? So tell me the answer. You should be knowing this answer, I think so. So I think I should not take more time to tell you the answer. Serratus anterior. The most common cause of scapula winging is what we used to say this also, winging of scapula, right? And the most common cause of scapula winging is serratus anterior paralysis resulting from a lesion of the long thoracic nerve. So there is a 2-3 questions come. Winging of scapula, which I already told you. Then serratus anterior paralysis. Then other thing is long thoracic nerve issue. The rupture of the muscle itself remains Uncommon. This is the image you can learn. Okay, winged scapula. Shoulder blade scapula. This looks like this. Now, where is long thoracic nerve? It's there. Where is serratus anterior muscle? It's there. Okay. Rhomboid muscle. This. When this, and this. This is rhomboid. This is serratus. This is dorsal scapula. This is trapezius, just over here. See? And what is the spinal accessory now? Over here. Okay, I hope you get this. Now last question. It is also an image based question. I am focusing on this because anatomy you will understand with the images more probably in a very good way, and this will makes you a vision memory also, and vision memory will last for longer. Okay, so stay connected with my video. Don't do anything else when you are just watching my video. Just focus on my video. The subsequent indication occurs as a result of damage too. When I am reading a complete question, you should also think that you have to read the questions with me correctly. So see this image, what it's asking. Which nerve? Tell me. Common peroneal, femoral, tibial, sciatic. Yeah, common peroneal nerve. Good one, very good one. You know this and you can do it. You can just do best in your exam. This is the common peroneal nerve. Right? What happens? Damage to peroneal nerve impairs the dorsiflexion of the foot. You can't even raise the foot. When common peroneal nerve get injured, you get the issue in raising of foot also. Okay, common peroneal nerve is this, deep peroneal nerve is this, and superficial peroneal nerve is this. The common fibular nerve, also known as the common peroneal nerve, external popliteal nerve or lateral popliteal nerve, is a nerve in the lower leg that provides sensation over the posterior lateral part of the leg and the knee joint. Common peroneal nerve injury can occur due to sudden trauma, chronic compression, or as a complication of other health conditions. What symptoms it includes? It includes weakness when raising the toes, numbness, tingling, and pain. Pain will be there, you know this, which can lead to a gait problem known as the foot drop. Foot drop happens because of common peroneal nerve. See, I am giving you another questions also with this explanation. That's why I put this explanation. It's not at all the thing that you get bored with it, that ma'am is giving a lot of explanation or a bigger explanation. There is a lot of questions behind it. Okay. Causes include leg injuries, fractures, prolonged pressure and tight casts, or high boots, or even positions during deep sleep. What could be the treatment? Treatment depends on the severity of the injury and may include physical therapy, medications, or surgery if it is required to repair the nerve. So that's all for this video. I hope you are liking the series and you're loving this. We have already completed the chain of 40, 60 also there with me. So I think most of the topics will be covered with this video itself in a 100 question series. So do connect it with my channel, subscribe my channel also, try to share it as it's new, but I think it will be definitely giving you some sort of benefits. So please just try to give this benefit to other persons also and help each other. Stay connected with me also. Don't shy to comment anything. If you want to give me any sort of advice, you can comment below and give me that advice. I will definitely try to cover it out. And thanks for watching me. Stay healthy, do hard work and study hard. Okay, thank you. Bye bye.